I started drinking at 12 years old. Started using meth at 14. Pretty much every drug that was put in front of me, I would use. When I first got clean and sober, I decided to go to work for myself and get my contractor's license. I had my license, I had my bond, I had my insurance, and I was off and running. After working for myself and developing carpal tunnel, my hands would go numb when I was working, and so I couldn't work. I had some past bills that I couldn't pay because of my carpal tunnel. I was diving deeper and deeper into my addiction because I felt there was no other solution, I guess you could say, to get the surgery that I needed so that I could work to pay these bills. I ended up making an attempt on taking my own life. When I came to Dr. Ryer and just told him, what was going on.
We had a long talk about what was important to him. He felt like he just couldn't do it anymore. It was too much. And that's when I was able to connect him with Sierra.
And he came in and just said, Sierra, I'm really struggling. And in fact, I've been having a lot of thoughts of suicide. I thought about killing myself, and on my way to our visit, somebody offered me fentanyl. And I thought, you know what, I could overdose and die.
I just thought she was just gonna be another therapist who would offer me drugs to just push me out, just another paycheck. She didn't offer me any drugs. She just offered me, support.
I was just thankful that he felt safe and comfortable disclosing that to me in his visit. And I kind of jumped in and gathered some of the other care team members to help.
Sierra came in with urgency, and she looked me straight in the eye and she said, I need a community health worker right now.
He listened to my story and actually listened to what was going on with me.
He told me he was scared. And to hear that from a father jolted me a little. Let's find insurance so we can help the carpal tunnel and get that surgery going. Ed also was struggling with a business truck payment. I was able to contact the credit union and arrange for a payment plan.
Having the surgery and recovering from that, I was able to, get back to work, and I have 8 months clean and sober now. The day before, I felt like I was out of options, and for them to get everything I needed by the end of the day set up, it was honestly, it felt like a miracle. I actually had a fighting chance at life again.
There's times where we struggle and we need people in our corner, and we need people to help us navigate life. And then we need to launch and do it ourselves, and then come back to a care team and to a support system that we know will help us navigate it. If Ed came to a place that didn't have integrated care, he would have got a referral for this, a referral for that, a referral for that. Rather, he got all those services in the same day, in real time, and he walked out of the door feeling hopeful and saying, Mosaic saved my life.
I mean, it's been a long, hard road, but with the support that I have here, it's made night and day. Because honestly, without them, I don't think I would be here. I just owe a lot to Dr. Ryer for not just seeing me as an addict, for seeing me as a real person, and taking the time to to understand what I needed.
People often ask, oh, you work at Mosaic, that must be challenging. And I said, no, it's amazing because people get better every single day. Catching people in the moment of need is the essence of team-based care and why it's so successful.
I did see Ed on the outside of the clinic setting not too long ago at a gas station. And Ed approached me and without any words, he just gave me a hug. And that was amazing. So, yeah.
I get to be an active participant in all of my kids' lives, you know? And watch them grow up. You know, get to coach their softball teams, basketball teams, that's like one of the coolest things I've ever done. It really is.